Hello, and on behalf of the North Carolina Department of Insurance and the Seniors Health Insurance Information Program, we welcome you to this Medicare 101, The Basics. I'm Lisa Barker, the SHIIP Northeastern Regional Manager.
And I'm Jeanie Schepisi, the SHIIP Field Operations Manager.
During this presentation, you will become acquainted with NC SHIIP,
and you will learn about the aspects of Medicare for 2022.
We hope that you find this information helpful and informative.
What is Medicare? Medicare is a federally funded health insurance program that provides coverage for medically necessary procedures, services, medical supplies, and equipment, and it is controlled and regulated by Congress. Medicare was created in 1966 to protect persons who are age 65 or older from major catastrophic health expenses. In 1972, Congress voted to expand Medicare coverage to include persons who are under 65 and who are receiving Social Security disability benefits for 24 continuous months. Persons who are diagnosed with ALS or Lou Gehrig's disease or end-stage renal disease, ESRD, which is permanent kidney failure due to a kidney transplant, or those receiving dialysis on a regular basis, are also eligible for Medicare. The Medicare program is administered by the Centers for Medicare and Medicaid Services, or CMS. And this is a branch of the Department of Health and Human Services, or DHHS. So these are federal programs. Another federal program, the Social Security Administration, is the federal agency that is responsible for Medicare eligibility and enrollment. Anytime that you receive correspondence from one of these sources, you need to open that information and see what it says, as it is the government trying to communicate with you regarding important information. Now, we're often asked, what is the difference between Medicare and Medicaid? Medicare and Medicaid are related and they are similar. They're both federal programs that are administered by CMS. Both Medicare and Medicaid look at your age and your disability status. But where the programs differ is that Medicare does not look at your income, resources, and assets, or your money. However, Medicaid does consider income, resources, and assets in determining eligibility. Persons can qualify for both Medicare and Medicaid as long as they meet the requirements for both programs, and Medicaid is always the payer of last resort. For Medicare beneficiaries who may not be eligible for full Medicaid, there are 3 levels of Medicare savings programs that will assist with the Medicare Parts A and B premiums, deductibles, and coinsurance or copayment amounts, depending on your eligibility. We will discuss Medicare savings programs in detail a little later. Now, do you need to enroll in Medicare Part A and Part B? And if so, let's look at when you can enroll in Medicare Part A and Part B. There are 4 Part A and B Medicare enrollment periods. On the first slide of the 4, we're going to talk about automatic enrollment. Automatic enrollment is for persons who are receiving a Social Security retirement benefit prior to turning 65 or becoming eligible for Medicare due to age, or for persons who are already receiving a Social Security disability benefit under the age of 65. Coverage will begin on the first day of your birth month, unless your birthday is the first day of the month, in which case coverage will then begin on the first day of the preceding month. The next enrollment period is initial enrollment, and this is a 7-month window that straddles your 65th birth month. So for persons who are not automatically enrolled in Medicare and who are not receiving a Social Security retirement benefit, they physically have to do something to enroll in Medicare Parts A and B, and this is known as your initial enrollment period. Your effective date for coverage will depend on when your enrollment occurs. So if you enroll the 3 months prior to your 65th birth month, that's actually the best time to enroll, as your Medicare coverage will begin on the first day that you turn 65, no matter what day of that month your 65th birthday is. You can also enroll the month that you turn 65 and the 3 months after. However, the longer you delay enrolling, then your coverage will be pushed back even farther. It is suggested that unless a person has an active group health plan, that a person enroll in both Medicare A and B so that they will not incur a penalty, and that is if they're not automatically enrolled. The third enrollment period for Medicare A and B is what we know as general enrollment period. General enrollment is for persons who are not automatically enrolled in Medicare and who, for whatever reason, did not enroll during their initial enrollment period as they were getting ready to turn 65. The general enrollment period occurs every year between January 1st and March 31st. Coverage will not begin until July 1st, so there is a delay in coverage. And there will also be a late enrollment penalty that never goes away unless that person qualifies for some level of Medicaid. So while the general enrollment period does roll around every year for people that were not automatically enrolled and who do not initially enroll themselves, there's a delay in coverage and there are penalties. And the fourth enrollment period for Medicare Part A and B is special enrollment period. And a Medicare beneficiary may be able to delay enrolling in Medicare Part B if they or their spouse are actively working and the employer providing the employer group health plan, or EGHP, has 20 or more employees, and that's for a Medicare beneficiary that's 65 and over, or if they're a Medicare disabled beneficiary and that employer has 100 or more employees. Special enrollment period for Medicare A and B is an 8-month period that begins when that employer group health plan stops or stops being primary. For example, when that person is retiring. Now that you know when you can enroll in Medicare Parts A and B, let's look at how you can enroll in Medicare A and B. Medicare eligibility and enrollment is the responsibility of the Social Security Administration, a federal agency. Medicare A and B enrollment can be handled by the Social Security Administration in a few ways. First, it can be completed online if you have access to a computer by visiting the www.ssa.gov or the socialsecurity.gov website at any time. You may also call 1-800-772-1213 Monday through Friday, 7 a.m. to 7 p.m., and a representative will assist you via the telephone. And please note that the Social Security Administration's call center does have extended hours. Also, appointments can be made for local offices through the above toll-free number. But please remember, during the COVID pandemic, the offices are not open to the public. Since mid-March of 2020, due to the COVID-19 pandemic, the local Social Security offices have been closed to the public, so face-to-face assistance will not be provided. To accommodate clients due to the office closures, you may contact the Social Security Administration by calling their toll-free number, or you may fax your Part B applications to 833-914-2016. Please be sure to include your completed and signed CMS 40B and CMS L564 forms with your fax. There are 4 parts to Medicare. This slide shows us that we have Medicare Part A, the inpatient or hospital part of Medicare, Medicare Part B, the medical or outpatient part of Medicare, and if you combine these 2 parts, A and B, you have what we know as Original Medicare. We also have Medicare Part C, which is a Medicare Advantage plan option. That is the managed care option of Medicare. And then finally, Medicare Part D, the prescription drug benefit. And this is coverage for outpatient prescription medications. When you become eligible for Medicare due to age, disability, end-stage renal disease, or ALS, you have 2 coverage options from which to choose. Original Medicare and its components, shown here on the left side of the slide, or Medicare Advantage or Part C, which is shown here on the right side of the slide. It is important for you to know what your options are and for you to consider and understand these options. So on this slide, we're going to focus on Original Medicare, which is your first option, and that's to the left, designated with a red arrow. Medicare Part A is the hospital or inpatient part of Original Medicare, and Medicare Part B is the medical or outpatient part of Original Medicare. The plus of this type of Medicare is that you can take it to any healthcare provider in any county and in any state, and as long as that provider accepts Medicare, you may receive services. There is no network of providers. The minus of this type of Medicare is that parts A and B alone are not enough to protect you from your out-of-pocket medical and prescription drug expenses. With this option of Medicare, it is fragmented. There are 3 individual insurance cards that you have to keep up with. Your original A and B card for Original Medicare, your Medicare supplement card that fills in the gaps where A and B leave off, and your Medicare prescription drug benefit card that provides coverage for outpatient prescription medications. With this type of Medicare, your costs are more upfront in premiums, but very little on the back end in copays and deductibles. So what does Original Medicare cover? On this slide, we see to the left that Medicare Part A, the inpatient or hospital part of Medicare, covers inpatient hospital coverage, and that is if you're actually admitted as an inpatient at the hospital. It also includes coverage for skilled nursing care in a facility that requires a minimum 3-day prior hospitalization and some other restrictions and qualifications. It includes home health care coverage, hospice coverage if you are considered terminally ill by your physician, and blood if you receive it in any of these settings. Medicare Part B is the outpatient or medical part of Medicare, and it covers outpatient hospital coverage if you're not admitted. That would be day surgery, the emergency room, or if you have some outpatient procedure. Physician services are covered under Part B as well, no matter where that provider sees you. Outpatient surgery and services, durable medical equipment, prosthetics, orthotics, and supplies. You'll notice that home health care is also covered under Part B, and it depends on what the situation is as to whether A or B covers home health, but that is a shared benefit under Medicare A and B. Preventive services are also covered under Part B, and we're going to speak of those a little later on. And if you receive blood in an outpatient setting or situation, it is covered under Medicare Part B rather than Part A. It's important to note that the blood deductible is a 1 per year opportunity. Whether you're under A or B or in one state or another, it's just a 3 pint or unit deductible per year. Medicare benefits are administered by the Centers for Medicare and Medicaid Services, which is a branch of the Department of Health and Human Services. What is not covered by Original Medicare? Outpatient prescription medications, routine dental care, routine vision care and eyeglasses, hearing aids, foreign travel, cosmetic procedures and treatments, and long-term care services. So let's take a closer look at Medicare Part A and B on the next few slides. On the next slide, we'll look at Medicare Part A. As wonderful as the Medicare and You Handbook is, it does not include the premiums, deductibles, and co-payments for Medicare A and B for the year. So this is a good way for you to find out what those costs are. So Medicare Part A is the inpatient or hospital part of Medicare. And what makes Part A a little different is that it pays based on what we call a benefit period. And a benefit period is defined at the top of this page. A benefit period for Part A begins on the first day that you receive services as an inpatient, which remember means that you're admitted to the hospital, and it ends after you've been out of that hospital or skilled nursing facility for 60 consecutive days. Most people do not pay a Part A premium because if you or your spouse work for at least 10 years and you pay in 40 credits or quarters to FICA, then your Medicare Part A is premium free when you become eligible for Medicare. However, if you do not work enough quarters or credits, or if you don't work at all, there may be a premium associated with Part A. Most people have premium free Part A Medicare, but in the event that you do not, we give the figures for both persons who did not work enough or persons who did not work at all at the bottom of this chart. This chart also lists the services that are covered under Medicare Part A. in the left column. The next column over gives the benefit period, depending on where you have the services, whether it's inpatient hospital or skilled nursing, home care, healthcare, or hospice. It also talks about what Medicare pays in that third column from the left. And in the very far right column, it does outline what you pay as the beneficiary out of your pocket. And these figures do change every year as of January 1 and are decided upon by Congress. You'll notice that for Part A, what you pay out of your pocket is not a percentage in most cases, it is an actual dollar figure. The next slide talks about Medicare Part B, the outpatient or medical part of Medicare. Again, we include the Medicare Part B premium at the bottom of the slide. For most people, that is automatically taken from your Social Security check before that check is deposited into your bank account. However, for people that are not receiving a Social Security retirement benefit, maybe they're waiting for full retirement age, which is beyond the age of 65, then Social Security will bill you every 3 months or every quarter for that Part B premium. However, in some cases, the premium may be higher. If you have a higher income, and that's called IRMA, then you will receive notification from Social Security 2 years after your income is above a certain amount, 88,000 or more individual and 176 or more for married couples. You will receive the letter in the mail from Social Security about 2 years after your income is higher than these amounts, and that IRMA will be calculated and taken, and they will add an extra amount to your Part B premium. Also, if you were penalized, you may pay a higher Part B premium as well because you did not sign up when you were initially eligible. Your Part B premium may be lower because you're receiving assistance from the state or because of the program called Hold Harmless. We also indicate on this chart in the upper right corner under you pay the Part B deductible. That's one time per year. The medical expenses or services, the services are listed to the left, and you'll see what those are. Remember that home health care is shared between A and B, and if you're not admitted to the hospital as an inpatient, then Part B would cover that as outpatient. The benefit under Part B is listed to the next column to the right. Medicare pays in that third column from the left, and then you pay finally to the far right column. And remember, these figures are subject to change January 1 every year according to what Congress decides. On the next slide, because A and B, as you've just seen in the far right columns labeled you pay, have deductibles and co-insurance and co-payment amounts, and we do not want you to be subject to paying those out of your pocket because some of those, for example, the Part A deductible can be quite costly. And that Part A deductible is not an annual thing. It may happen more than once a year depending on your benefit period. And so for that reason, we strongly suggest and highly encourage people, if they're going to go the original Medicare route, to purchase a Medicare supplement policy. And you have to purchase this separately and pay an additional monthly premium for that. These plans are standardized nationwide as of 1992, and they were designed to fill in the gaps where original Medicare A and B leave off, hence the term Medigap. Plans are designated by letters A, B, C, D, F, G, K, L, M, and N. You'll see a few letters are minus there, and we'll look at that on the next slide. Plans C, F, and F prime are only available to individuals who were eligible for Medicare prior to January 1, 2020. And that's if companies are still offering those particular plans. Many companies are not offering plans C, F, and F prime anymore. All of these plans cover a basic group of benefits, and there are some plans that cover additional benefits. Coverage is the same from company to company, but premiums do vary. And what that means is when we look at the next slide, you'll see the benefits listed under each plan, and companies cannot alter and change the benefits under each plan. They are carved in stone. This presentation does not address how Medicare works with other insurance or coverage, such as employer group health plans, COBRA, TRICARE, or VA benefits. And it's important to note while we're talking about Medicare supplements that persons who are eligible for Medicare under the age of 65 tend to have higher premiums because they're more at health risks. This slide outlines the Medicare supplement plans that are available now, A through N minus a few letters. The column to the far left gives us the benefit, and then under each plan designated with letters A through N, it tells us what the benefit is or what the percentage of that benefit is. There are plans that do offer some lesser coverage because the premiums are lower. Those are more cost sharing plans. And there is a plan that's called G Prime, and you pay a lower premium for that, but the premiums are considerably lower for that G Prime plan. So this chart is an overview of the standardized supplement plans that are available as of 1992, with a little varying over the years. Every state except for Massachusetts, Minnesota, and Wisconsin, where Lisa is from, has this identical A through N chart, but Massachusetts, Minnesota, Wisconsin have their own Medicare supplement charts because they had standardization before 1992 when the federal government stepped in. On the next slide, we talk about Medicare Part D, as in David, and this is the prescription drug benefit. So for 40 years, from 1966 to 2006, when people received a prescription from their physician and they went to their pharmacy, that was not covered by Medicare. If you were at the hospital as an outpatient and you received a prescription medication, that was not covered by Medicare for 40 years. So Congress decided that in 2006, Medicare Part D would be created. And so since 2006, people who are receiving outpatient prescription medications can now get some coverage for that. And we've seen that that is very helpful for people. So anyone covered by Part A and or B is eligible to purchase a Part D prescription drug plan. These plans are sold by private insurance companies that are contracted with Medicare or the federal government, and they require monthly premium payments in most cases. Each plan covers a group of prescription medications, which we know as a formulary, and they typically have co-payments for prescriptions and possibly an annual deductible. But every year there is a limit on what that deductible can be. Plans and formularies may change annually, and this is why, again, we strongly encourage and highly suggest that you be sure to compare your Medicare prescription drug plan every year during the Medicare open enrollment period. And that's whether you have a standalone Part D plan or your prescription drug benefit is included as a part of your Medicare Advantage plan. So when can you enroll in a Medicare Part D plan? Well, first of all, when you first become eligible for Medicare due to age or disability, you have a 7-month initial enrollment period that you can enroll in a Part D plan. After this time frame has elapsed, you also have the Medicare open enrollment period, which is an annual event that rolls around every year from October 15th through December the 7th. If you enroll or change or switch a Medicare Advantage or drug plan during this time of the year, your coverage will begin on January the 1st. And again, we highly encourage you to take advantage of this Medicare open enrollment period during the fall of every year to make sure that you have the best coverage for the best money, because the plans do change from year to year, and SHIIP can help you with that. You may be able to join or change plans at other times. For example, there's an annual Medicare Advantage open enrollment period that's January 1 through March 31st of every year. And then that's only for people that have Medicare Advantage or Part C plans. And then you may qualify for a special enrollment period. However, you must meet certain requirements or restrictions. One of these is when you qualify for extra help, you may be able to change plans more often, or if you move out of your county or state, you may be able to change your plans at that time. Part of the Medicare Part D program is what we know as extra help. And extra help was created in 2006 as well, because Congress realized that even with allowing people to purchase a Medicare prescription drug benefit, some people may not be able to afford those monthly premiums or the deductibles or copays on the back end. So extra help is affiliated or associated with Medicare Part D. Financial assistance is available for people with limited income and resources or assets. And these resources and assets and income amounts change every year. Eligibility is determined by the Social Security Administration. However, your friends at SHIIP and your friends at the Department of Social Services can also help you with extra help application in addition to your friends at Social Security doing that. If you qualify for extra help, it can reduce or eliminate monthly premiums for your drug plan. It can reduce prescription co-payments and provide a quarterly opportunity to make a change in your plan. Your quarterly changes are available only during the first 3 quarters of the calendar year. So for example, you may make one change to your prescription drug benefit from January 1st through March the 31st, and that change will be effective around that time. You may also make a change April 1st through June 30th, and the change will take place around that time. And then you have another opportunity July 1st through September 30th with the change taking place around that time. You do not have an opportunity if you qualify for extra help to make a change the last 3 months of the year because Medicare open enrollment is October 15th through December the 7th. So you have that opportunity, but remember, the change will not take place during the end of the year. It would take place January the 1st of the next year. Your next option for your Medicare coverage is what we know as Medicare Advantage or Medicare Part C. And that's on the right side of this slide, designated with the red arrow. These are what we call managed care plans because it combines your medical benefit and most often a prescription drug benefit with the use of network providers. So for Medicare Part C, when you join that plan, you're still in the Medicare system. However, you no longer use that red, white, and blue original Medicare card. You're joining your Advantage plan and it is replacing original Medicare A and B. So while you still need to carry that A and B card with you in your wallet or your purse, when you join a Medicare Advantage plan, the company will give you a new card and you will use that card in place of your A and B original Medicare card. So you can safely carry both of those cards in your wallet or purse, but just put your Medicare Advantage card in front of your red, white, and blue original Medicare card. We're going to focus on Medicare Advantage or Part C on the next few slides. So Medicare Advantage or Part C are health plan options that are approved by Medicare and regulated by the federal government. So companies that decide they want to be Medicare Advantage contractors do have that written contract with the federal government. It's another way for you to have your Medicare coverage. You are still a part of the Medicare program, and Medicare Advantage plans are offered by private insurance companies who, again, are contracted with the Centers for Medicare and Medicaid Services. Medicare pays the plan and amount for each member's care. You may have to use network healthcare providers, for example, doctors and hospitals, labs, home health agencies, skilled nursing facilities. So we encourage you to always check with your healthcare providers before you join or sign up for a Medicare Advantage plan. The types of plans available vary from county to county. The drug plans vary from state to state. So when you're looking at a Medicare drug plan, what we have in North Carolina may be different than what they have in South Carolina, but the Medicare drug plans are the same within the state. However, when you're looking at joining a Medicare Advantage plan, those vary county by county. So you will need to visit the SHIIP website to find out what Medicare Advantage plans are available in the county in which you reside, and that's according to your zip code. In addition to enrolling in Medicare, there's an additional opportunity to change your Medicare Advantage plans from January 1 to March 31st of every year. But again, in order to do that, you must have a Medicare Advantage plan. When and how can you enroll in a Medicare Advantage plan? So first, just like with original Medicare, you can enroll during the initial enrollment period, and that's when you first become eligible for Medicare. You also have the opportunity every fall during the annual Medicare open enrollment period. Again, this is October 15th through December the 7th. It's about a 7-week window that we encourage you to compare your Advantage plan to make sure that you have the best medical coverage and the best prescription drug coverage for the best cost for that next year. Because remember, Medicare Advantage plans can change from year to year. During the Medicare Advantage open enrollment period, and that's January 1 through March 31st of every year, but you've got to have a Medicare Advantage plan to be able to do that. And you can go from one Advantage to another. You can pull out of Medicare Advantage and return to original Medicare. So there's just a handful of things that you can do during this first 3 months of the year. And you may be able to join or switch Medicare Advantage plans at other times based on special enrollment period qualification. You have to qualify for this and meet certain requirements. And an example of this is, again, moving to a different county or state or qualifying for extra help. If you're ever wondering, can I make a change to my plan or can I enroll? Please reach out to the SHIIP organization and we can help you decide based on your situation if you can make changes throughout the year. Now let's talk about original Medicare versus Medicare Advantage plans. How do they work in comparison? So on the left, we have original Medicare that covers your Part A, inpatient and hospital, and your Part B, outpatient and medical benefits. This type of Medicare provides coverage to you directly. You have the choice of doctors and hospitals that are enrolled in Medicare, and as long as they're accepting new patients and they're accepting Medicare beneficiaries, then you are set to go. You don't have to ask, are you in the network? You can take this kind of plan from any county in any state between healthcare providers, and it will work. There is no network. You generally have a supplement policy to fill in the gaps of deductibles and co-insurance or co-payment amounts. Remember, we don't want you to be exposed and vulnerable for those out-of-pocket expenses because they really could wreak havoc on your wallet. And you usually pay a monthly premium for Medicare Part B. Again, your Part B premium could be higher or lower. This year it's $148.50 a month. It can be higher or lower depending on your situation. On the other side, Medicare Advantage covers Part A and Part B benefits, and you have to be enrolled in both Part A and B to enroll in a Medicare Advantage or Part C plan. They may offer some additional benefits like dental, vision, and hearing, and that's attractive to many people. This coverage is provided by private insurance companies that are approved by Medicare and they're contracted with the federal government. In most cases, you need to use the plan's doctors, hospitals, or other healthcare providers, and that's what we call a network. Some type of Medicare Advantage plans are very restrictive, like HMOs or health maintenance organizations, and you have to remain in that network to receive covered care. If you go out of that HMO network, it will not pay. You will pay everything out of your pocket. PPOs, or preferred provider organizations, are a little bit more flexible. They prefer that you stay in the network and you pay your copay, but they do allow some flexibility for you to go out of that network and see out-of-network providers. And if you do that, you will pay more and the plan will pay a little bit less. And there's 4 or 5 types of Medicare Advantage plans in North Carolina for 2021. You may also pay a monthly premium in addition to the Part B premium. So no matter how you have your Medicare, under original Medicare or a Medicare Advantage plan, you still pay that Part B premium. That's a given. For the Medicare Advantage plan, you may pay an additional premium for that. And people find that attractive because it's usually less than that of a Medicare supplement monthly premium. Some people can purchase Medicare Advantage plans and not pay a monthly premium because companies get amounts from the federal government and they decide that with the amounts that they're getting from the federal government for the beneficiaries that they enroll, they can provide good benefits and keep those costs low. So you may enroll in a Medicare Advantage plan that does not have a monthly premium, and that's of course a good savings. And then you would have a prescription drug benefit option. There are Medicare Advantage plans that are called medical only that do not provide a prescription drug benefit. And people who have prescription drug benefits through a former employer or they're getting their prescription drug benefits through the VA may decide that a Medicare Advantage medical only is the right kind of coverage for them. On the next slide, let's talk about the differences between Medigap or Medicare supplement policies and Medicare Advantage. Medicare supplement plans only work with original Medicare A and B. Medicare supplements do not work with Medicare Advantage or Part C. And in fact, it's illegal for someone to sell you an Advantage plan to work with Original Medicare and a supplement, or vice versa. So you should be asked what kind of coverage you currently have to determine what you may need to replace it with, or what you might need to add on to. So Medicare supplement insurance policies that work with A and B are offered by private insurance companies that are regulated by the Department of Insurance in the state in which you live. They have to be licensed within that state and meet certain guidelines. There is some slight government oversight, but for the most part, the A through N chart and the plans and the benefits, that is federally regulated. So plans A through N supplements, those benefits that are outlined, that are standardized nationwide, must follow federal laws. And that's a federal law and not a state law. Medicare supplements work with Original Medicare A and B only. They do not work with Advantage plans. And they cover gaps in Original Medicare like deductibles, co-insurance, and co-payments. You must have parts A and B, both Medicare Part A and B, to purchase a Medicare supplement. And yes, you will pay a monthly premium for that policy, depending on what plan you purchase, and other factors will determine what your cost is for that Medicare supplement premium. And remember, you will pay the Part B premium as well in most cases. Medicare Advantage plans are offered by private insurance companies as well, but instead of being regulated by the state Department of Insurance, because it's a Medicare product, they are regulated and contracted with the federal government, regulated by and contracted with the federal government. And they must be approved by Medicare. Medicare Advantage plans do not work with Original Medicare A and B or supplements. And Medicare Advantage plans cover all Part A and B covered services and supplies. They may also cover things such as dental, vision, and hearing, and a fitness benefit. You must have A and B as well to enroll in a Medicare Advantage plan. Just like if you purchased a supplement, you have to have A and B. And you may pay an additional monthly premium to purchase that Medicare Advantage plan, or you may not, depending on the plan. On the next slide, Medicare savings programs, and we mentioned this a little earlier. So for people with limited income and resources, you may qualify for full Medicaid, and that's a very helpful assistance program. And something that you can rest assured of is every client that SHIIP touches, we screen our clients for extra help and Medicaid eligibility. We ask them those personal sensitive questions about income and resources, not to be nosy, but to determine if they may qualify for some type of assistance for Medicare A, B, and D. So one type of assistance is what we call Medicare savings, and this sits just below the full Medicaid level. So if we're screening clients and we determine that maybe they do not qualify for full Medicaid, then we probe a little farther and ask them income and resource information. And if it's determined that they may not qualify for full Medicaid, but they meet certain requirements, then they may qualify for assistance called Medicare savings programs that will help with their Part A and B premiums, deductibles, and co-insurance amounts. And there's 3 programs called QMB, SLMB, and QI1. And depending on what your income amounts are, determines what level of assistance you get. The resources and asset levels are the same for all of these 3 programs, but what varies from program to program is the income amount. The eligibility is determined by the local county Department of Social Services. So you may contact or go to your local Department of Social Services to apply. When we are screening people that we assist through our SHIIP program, we can also do the extra help application and allow it to cross over to the local Department of Social Services, making it streamlined, easy, and then you do not have to make that trip to the Department of Social Services. They will reach out to you via telephone. You can reduce or eliminate your Part A and B premiums through Medicaid, Medicare savings programs. However, you do have to qualify financially for these programs. And remember, that's where Medicaid programs differ from Medicare. On the next slide, we're going to talk about preventive care, and this is one of my favorite things to discuss. By your making sure that you receive some of these services every year, you're keeping yourself healthy and well. If something is detected detected, you hopefully will catch it early. You may also find that everything's just fine and you save yourself and the government money. And I compare our bodies to vehicles. We take our cars in for servicing ever so often for a 5,000-mile checkup just to make sure that everything's working properly, and your body is the same. So does Medicare cover preventive health care? And the answer is yes. Whether you're receiving original Medicare under A and B, or you're receiving your Medicare through a Medicare Advantage or Part C plan, preventive health care is covered. Under original Medicare, it is covered under the Part B benefit, the outpatient benefit. You will see some Medicare services listed alphabetically. And if you happen to see the Apple icon or logo, and that's what's between the Medicare and You handbook on the left side and the Guide to Preventive Services on the right, most of these services, thanks to healthcare reform, you do not have to meet a deductible for Part B before it's covered, and you do not have a copay or a co-insurance amounts. We encourage you to take advantage of that. I tell people, if you pay your Part B premium as you should for A and B or the Advantage plan coverage, and you do not take advantage of these preventive benefits, it's like going shopping and filling up your buggy, going to the checkout counter, and you pay for these items, and then you leave your buggy there at the store. So you are paying a Part B premium regardless of how you have your Medicare. You need to take advantage of these services. It may keep you healthy, well, save your life, and it will definitely save you money in the long run.
Just like each state has a state health insurance assistance program, every state also has a senior Medicare patrol program. SMP is a national program for people of all ages, and it's administered by the Administration for Community Living, or ACL. North Carolina's SMP is located within the Seniors Health Insurance Information Program, which is located within the North Carolina Department of Insurance. The goal of North Carolina SMP program is to empower all Medicare beneficiaries to prevent healthcare fraud, waste, and abuse through education and outreach. NC SMP counselors are comprised of retired professionals, senior citizens, and partnering human service agency staff. Their mission is to provide education about Medicare errors, fraud, waste, and abuse. All SHIIP counselors are cross-trained to be North Carolina SMP counselors. Their goal is to educate beneficiaries within their communities to protect, detect, and report Medicare fraud, waste, and abuse. NC SMP aims to reduce Medicare errors, fraud, and abuse by educating consumers within the state of North Carolina. Medicare loses an estimated $68 billion, yes, I said billion with a B, dollars each year to errors, fraud, and abuse. Every day, these issues affect countless Medicare beneficiaries nationwide. The good news is that by following some simple tips, you can protect yourself and Medicare against this waste. Protect. You need to protect yourself against Medicare fraud. Even though the new and improved Medicare numbers do not contain your Social Security number, you still need to protect your Medicare number just like you would your debit or credit card or your driver's license. Protecting your personal information is your best defense against healthcare fraud and abuse. You can detect potential fraud, errors, and abuse. Be sure to carefully review your healthcare statements. Open your mail. Medicare summary notices, and other insurance explanations of benefits. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Detect. You can detect potential fraud, errors, and abuse if you suspect that you have been a target of Medicare-related fraud and abuse. Report it. This will help you and others who may be at risk for healthcare scams, and it will help to preserve the Medicare system. Contact North Carolina Senior Medicare Patrol by calling our nationwide toll-free call center at 855-408-1212, Monday through Friday, 8 a.m. until 5 p.m., or email your name and telephone number to ncsmp@ncdoi.gov, and one of our NCSMP specialists will contact you. Now, to transition and talk about the Medicare.gov website. For those of you who have access to a computer, or you know someone who does, the Medicare.gov website is a valuable resource. When you access the Medicare.gov website, you can locate general Medicare information, and you can view your personal Medicare information online. When you visit Medicare.gov, you will be able to get information about the Medicare health and drug plans in your area, including what they cost and what services they provide. You can find Medicare participating doctors or other healthcare providers and suppliers. You can see what Medicare covers, including preventative services that we spoke about earlier. You can get Medicare appeals information and forms. You can get information about the quality of care provided by plans, nursing homes, hospitals, doctors, home health agencies, dialysis facilities, hospices, inpatient rehab facilities, and long-term care hospitals. You can also look up helpful websites and phone numbers. If you choose to create a Medicare.gov account, you will be able to add your prescriptions and pharmacies to help you better compare health and drug plans in your area. You can sign up to go paperless and receive your yearly Medicare New Handbook and Medicare summary notices electronically. You can view your original Medicare claims as soon as they are processed. You could print a copy of your red, white, and blue original Medicare card or request a replacement card. You can also see a calendar of preventative services that you are eligible to receive under your original Medicare Part A and B, which again, we think preventative services are a really good way to protect yourself as well as your bottom line. Learn about your Medicare premiums at Medicare.gov, and you can pay them online if you do receive a bill. So for instance, we previously spoke about people who were not receiving their Social Security benefit, receiving a statement to make that monthly payment. You actually can now go online and pay them instead of making a quarterly payment with that bill. Now, this is the good stuff. If you or someone you know is interested in learning about the many aspects of Medicare, you might be interested in becoming a SHIIP volunteer. When you learn about all those aspects of Medicare, you can share that knowledge with others within your community. North Carolina SHIIP is always looking for new SHIIP volunteers. We are looking for people who have the desire to help others, who have good people skills, and who will keep a client's medical and financial information confidential. You need to be willing to complete an online basic training course, which will be factual You will be able to be factual and impartial. You need to be committed to entering all of your counseling and outreach data into our STARS national database. SHIIP volunteer counselors cannot be or have an immediate family member who is an active licensed insurance agent. It is a rewarding experience to educate and inform people so that they may make good decisions that they feel comfortable with and confident in. We would love to have you as part of our SHIIP crew. So where can you get help? Helpful resources that are out there are through us, the Seniors Health Insurance Information Program, and North Carolina Senior Medicare Patrol. And we can be reached at 855-408-1212, Monday through Friday, 8 a.m. until 5 p.m., as well as our website of www.ncshiip.com. Another resource would be the Medicare website at www.medicare.gov. You also have the Social Security Administration, and their phone number is 800-772-1213. And they have expanded hours of 7 a.m. until 7 p.m. And also their website is www.ssa.gov. So again, these are all really good resources for you. All right. One of the other ways that you can get help, and it's almost like helping yourself, is your Medicare New Handbook. Remember, it is the owner's manual for people who are on Medicare. For most any Medicare question that is asked, the answer can usually be found in this informative government publication. Now, mind you, I don't expect you to read it from cover to cover when you receive it, but I do want you to keep it handy so if you need to look for something and you have a question, be your own best advocate. Look at the table of contents and index to help you navigate this very important document. Okay, if you have any questions, you can contact SHIIP by calling 855-408-1212, Monday through Friday, or you can visit our website at www.ncshiip.com, or you can email us at ncshiip@ncdoi.gov.
Thank you for joining us, and we hope that you learned a lot from our presentation.
Have a great day.